Yeah, I'm looking to see, just what it's like. Oh, yeah.
You have a little space.
Oh, no.
Office. Okay.
So, I'm trying to get an understanding of what it's like to be a pediatrician, so I was wondering if you could describe for me, like, a typical day.
Typical day?
Or maybe they're not so typical, I don't know. But
Well, every practice that you go in is a little different. So, to become a pediatrician, you have to go to college, and then you have to complete, like, the core courses. You have to take a test called the MCAT, and then that's kind of like your pre-test to get into med school. And then med school you start interviewing for in your senior year of college. Then you get accepted to med school, and you go to med school for 4 more years. Okay? Then when you're in med school, you kind of decide what kind of doctor you want to become. The first 2 years of med school are learning basic sciences about the body and kind of anatomy, all sorts of things like that. Then the second 2 years, you do rotations called clerkships, and you go and you try out a bunch of different kinds of medicine. And then they hope that during that period, you kind of decide what kind of doctor you want to be. In your 4th year, you kind of finish more tests, and you start applying to what we call residencies. Residencies are how you decide what kind of medicine you want to do. So when I was before I was even in med school, I knew that I wanted to be a pediatrician. And then I got in med school and I did all my clerkships, and I kind of knew that I wanted to be a pediatrician, even more.
For sure, yeah.
Because I loved working with the kids. That was my favorite rotation, that kind of thing. And so I knew that I wanted to do that, so I had to apply for residencies just in pediatrics, okay? So you go to all these interviews, and you decide where you want to do, and then you make a list that's in order of, like, what place you like the best. And they also make a list of all the people that they do something. She's interviewing me for a school project. So.
Oh, yeah.
Yeah. So they also make a list, and then on one day, everybody all finds out where you're going to go, because they use some big computer program. So then you go, and you do residency. Now, different kinds of doctors do different lengths and different types of residency. So for pediatrics, it's 3 years, okay? And then, but for, like, surgeons, they do, like, 5 years. So it's kind of variable, because there's lots of different types of medicine. So I did my residency, and then while you're in residency, you get to decide even further what kind of pediatrician you want to be. So I'm considered a general pediatrician, which means I take care of outpatients mostly, and I do also care for like newborns that are in the hospital. We go and we check on them here. But there's also pediatricians that are just dedicated to certain parts of pediatrics, like pediatric cardiologists that only deal with heart problems in kids and those kind of things. And so they would do fellowship, but I didn't do a fellowship because I just wanted to do general pediatrics. So after I finished my residency and I decided that I wanted to be a general pediatrician, I have to look at, like, what kind of practice. So this practice, what I do here on general most days, we'll just do today. So this weekend, I'm the doctor on call. So I'm in charge of seeing the babies in the nursery that we have before I come in. So this morning, I got up early at about 6 o'clock, a little before then, and I got ready, and I already knew that there was a baby in the nursery. So I went to the nursery and saw the baby for the first time. So I examined this baby. This baby never been examined by a pediatrician, so I examined the baby, checked the baby out head to toe, made sure that the delivery was okay, made sure that there weren't any problems. And the baby's mom had some high sugars while she was pregnant, and so we checked to make sure the baby's sugars are okay. So I checked to make sure that the baby was okay and feeding okay. And then I finished up with that, and I headed over here. And on our schedule, we usually have our physicals, and we also have our sick visits. So, you know what physicals are, right? So you come in, you get checked out. It's like you're usually yearly. We do any vaccines that the kids need at those visits. And then also through the day, we get people calling that their child is having a sore throat or fevers, and we tell them when they can come in, and we see them. So this practice is really pretty busy. Some places are a little slower, some places are a little busier, and this is a busy practice, so it's good because we keep moving all day long. So here I saw a couple physicals this morning, and then I saw a couple sick visits. Sometimes, when I'm seeing kids, I'll want to recheck them later, so I'll say for the parents to come back later. So I had a couple people that were what we call rechecks or follow-up visits, where it was because, something we had talked about before. I wanted to make sure things were getting better and things are improving or things are different for the child to make sure they're doing okay. And then, I saw a lot of kids with strep throat today, ear pain, those kind of things, colds, coughs, sinus infections. But I saw, then this afternoon, I saw some more physicals, because we usually do the physicals in the earliest part of the day and then right after lunch, because when we have healthy kids coming in, we don't want them to get sick, right? From the people that are coming in for the sick visits. So we try and do it that way if we can.
That makes sense.
And it's kind of nice. I worked with Dr. Januzzi today. He's one of the other pediatricians. And we kind of just, for the kids that aren't specifically scheduled to see us, we just take turns.
Okay.
We have a chart, and we just pull it out, and we say, okay, this is my turn to see this patient. So we just kind of check them all out, and that's most of the day. Usually at lunchtime, I am calling people back about lab results that I've gotten back, or people that have called in with questions, those kind of things. And then in the evening, sometimes I'll do that too. Then on days that you're on call at night, like I'm not on call tonight, but one of the other doctors is, and tomorrow I'll be on call at night and all weekend. And so when we leave here, we have an answering service. That means that's a line that all the families can call if they have questions or concerns, and so that they don't have to go to the emergency room for every little question or those kind of things. So they call the answering service, and then we call every 2 hours to see what those calls are, and we call them back. So that's a different kind of medicine, and we call that telemedicine.
Okay.
That's where you're basically trying to do medicine over the phone, which is hard, right? You can't see a patient. You have to ask the right questions to know what's going on. So that's on nights that we're on call. And then sometimes we're on the weekends, and we see patients just here on the weekends and answer those same calls. But that's most days. Some practice are going to be about the same as what I do, and some will be a little different. Here in...
Do you have a question,